Dr. Mitchell, thank you so much for coming here to spend some time with us. We're going to start out, ask some few questions just to get to know each other a little bit. So can you tell me a little bit about how your time has been in Ohio as a Black immigrant, like living here?
Sure. So I have only been here for 3 months, so it's based on my very limited experience, and so far I think it's great. I have lived all over the U.S., so it's not particularly difficult for me, I think, not a very challenging adaptation. And I also find that being a Black immigrant, I have very small communities, and I feel like my communities find me more than me finding my communities. So I already know where to get good Jamaican food. I already been to the Jamaican market. A Jamaican woman found me and met me at the store and took me around how to find things. And I find that that's kind of like how everywhere I go, that's how it's been. When I lived in Salt Lake City, I knew all the Jamaicans in Salt Lake City. And so I find it hasn't been that bad, to be honest.
Can you tell me a little bit about what you do in your free time?
In my free time, I don't have free time. So I have 2 kids, so the concept of free time is like out the window. If I do have time, I take my son to the park, or we do something, usually something revolving around kids. Other than that, I really don't do much. I work out occasionally, not as much as I used to, but yeah, for my me time.
Okay. Mm-hmm. Well, you mentioned you have 2 kids.
Yeah.
Tell me a little about them.
So I have a 4-year-old son, Lucas, and a 4-month-old, Zuri. So Lucas was born when I was in residency in California, and then Zuri was born just after I finished fellowship in Hopkins. So she's a pandemic baby. I was pregnant with her through all of the COVID-19. Then she was born during COVID-19, so yeah, pandemic baby.
So right in the transition here.
In the transition time, yeah.
I see. Mm-hmm. So around that same time of your transition, you made this epic post on Twitter, and I think it was also on your LinkedIn, mm-hmm. Where you talked about your 20 years of cumulative training to this point, to become an independent physician, mm-hmm. where, you've done the PhD, you've done the MD, and now it's together, now you're fully trained. What does that mean? Now you can have your lab. Tell us a little bit more about that.
It's so interesting because I made that post. It wasn't meant to be a post that everybody, it's probably one of my most viewed posts on any social media platform. But when I posted it, it was just I'm done kind of feeling. It wasn't let's celebrate. It was whoa, this has been a long journey, But I think people probably identify with it because they go through things and they think it's just a quick fix. I'm going to do this and I'm going to do that. And they realize not all of life is a quick fix, and it's okay if it takes you a longer time. And in reality, it's not a long time. It's just what it takes. It's actually fairly short when you think about it, because medical school is 4 years, undergrad is 4 years, PhD can be anywhere from 5 to 6 years. If you do a combined MD PhD, 7-8 years. So it's all relative, and people don't think about it in that context. It's just when you put it out like that, you just realize wow, that's a really long time to be training.
Indeed, and I think for first generation college students, med students, grad students, mm-hmm. Where their families are expecting them to go to college or med school, and get their degree right. and come out in the working world and start taking care of their families. Right. Them seeing this 20 years, right, it may seem daunting. Mm-hmm. What do you have to say to them as they may be looking, they're looking to get an MD, PhD, mm-hmm. but are afraid to take that long route? What do you say to them?
It's short in the context of your career. In the context of if you're doing something you love, it's not a long time. And I do think people shouldn't think in terms of how long it takes to get from point A to point B. You should think, what are the steps in point A to point B, and just enjoy each journey and give each step your fullest, because it may end up that maybe an MD PhD is not what you want. Maybe it is what you want. So if you're in college, focus on being done with your college degree, and what's the next step for you. For me, I thought I was gonna go to college, go to medical school, be done. That was always my goal. That was my dream. In college, I did a lot of research. So I went to a historical Black college, HBCU, Benedict College in South Carolina. Very small college, and what that fosters is a sense of community, and your mentors really try to shape you and help you. And so I ended up doing a lot of research because my mentors pushed me to do research, not because I knew anything about research. I didn't go to college thinking I was going to do research. But that was how I fell in love with research. And so after college, it was easy for me to say, okay, I still thought I was going to do medical school, and then I took MCAT and I did not do well. And then I took the MCAT again and I did not do well. And then I had no money and I was like, there's no way I'm gonna end up going to medical school. And I took the GRE and I did extremely well. And I thought to myself, maybe this is a sign that this is the way I should go. I'm good at research. I did well on my GRE exams. And so then I applied for graduate school, and I was interested in epilepsy research, so I went to the University of Utah. And I think for me, I enjoyed graduate school. I didn't go to graduate school thinking this is a stepping stone to get somewhere else. I went to graduate school thinking I'm going to do research, and I'm going to do research well, you know? And so I went to graduate school, finished graduate school, and then medical school. So it wasn't like I have 20 years ahead of me. It was steps, small steps.
Thank you. So, you know, I think it takes a very strong person to go through all of what you've gone through, right? It's not easy to get into medical school, definitely. Right. You had obstacles, you took a different route, but you still ended up going to medical school and have your MD, PhD. So for that resilience that was built in, many people say some of it was built in along the path, but you know, some of it was probably seeded at an earlier age. Probably in Jamaica. Can you tell me a little bit about your childhood in Jamaica and like some of the things you believe in that experience that really solidified your resilience on that path to the MD PhD?
Absolutely. Thinking about resilience and building resilience, I do think like your formative years really shapes who you are and shapes how you approach life. And so I grew up in Jamaica, tiny town, Gibraltar. I knew all my neighbors for miles around. And so I always felt like I had that sense of support. And people say to me like, wow, how did you think you were gonna be a doctor from small town Gibraltar? And my answer is I never thought I wasn't going to be a doctor from small town in Jamaica. Ever since I recall, I remember saying, that's what I want to do. And I don't recall ever thinking I wanted to do anything else. And everybody in my community would say, oh yeah, that's Speedy daughter, she's going to be a doctor. Like it was never a, no, you're not going to be a doctor. You know, no, I didn't have lots of naysayers. And I find that when you have that support structure and that internal system, it builds you, and it gives you that confidence that you don't think something is too hard, I'm not going to do it. And I think it's important for when we speak to our children and when we speak to people around us to speak positivity and not speak of the obstacles, but speak of the end point, that they're going to be able to achieve things. And yeah, there are going to be obstacles, but they'll have the resilience to be able to overcome it because they know that they can achieve whatever they set out to do. So.
talk. And, sorry to cut to the Jamaican platter there, but I hear you talking, and I hear my grandmother, and I hear my neighbors, as you mentioned. Like I also grew up in Jamaica in St. Mary, and I hear in a small town too, Aracabessa, and I also hear them saying, "Oh, you know, that's Candace's kid. You know, they're smart. They're going to be a doctor. Right. They're going to become the next best thing." So that's kind of sort of, where culture comes in here, right? And that cultural space, kind of sort of molds you. We were talking off camera earlier, you mentioned that your family isn't here with you in America. So how do you kind of sort of, draw on that culture to sustain you on these like, really long journeys?
Right, so drawing from my family, I do think like my family keeps me humble. the people in Jamaica, it keeps me grounded. And so I never feel, somebody else said to me, you just always stay hungry. Like you always just want to keep doing things because those are the people who are looking at you and they expect to see you succeed. They never are thinking that you're gonna fail. I remember I would say to my mom, like, oh, this is like something that's challenging. I'd been like, when I was in medical school, right? So my mom didn't go to high school. So when I'm in medical school, there's no way she understands what I'm doing in classes. But she could talk me through stuff. I could call her and she'd say, oh yeah, but that's easy for you, right? Because you're so smart. You're the smartest person at Stanford. I'm like, Mom, no, don't say that. But this is how my parents view me. They would always think, oh, that's not so hard. Maybe you just need to sleep some more and then look at it again. But it's just that family and their belief in you, their steadfast belief in you, you can't help but believe in yourself. So my parents are funny because they will tell you, if you spoke with any of my family, they will tell you, oh yeah, she's always been the smartest person we know. So, but yeah, it's interesting.
I can completely relate because that's funny. I took a practice step session. I was like, Grandma, I got a 77. She's like, that's bad. Like, are you supposed to get better? And I was like, yeah, like I'm trying to get 80s on every single one of these. And she's like, it's okay. Like the Lord's with you. And she goes into prayer. So that's another thing, like, very, very rooted in culture and prayer too. That's important. And I know that's a really big part of a lot of Black communities. Where like that's in a cultural space, so someone's always praying for you, which is good. So you mentioned kind of sort of in your earliest dreams, in your formative years, you kind of sort of knew you were going to be a doctor. What did that dream look like? Did it look like MD, PhD at one of the, top medical schools across the country and probably top everything across the country? Did it feel like that, or was it, oh, I'm just going to be a doctor, and that was it?
So no, I never thought I was going to come to the U.S. For me, growing up, I thought I was going to go to the University of the West Indies, and that was my dream, that was my goal, that someday I was going to go to UWI, I was going to be a physician, and I was going to practice in Ocho Rios. I was going to have my own practice in Ocho Rios, Jamaica. That was my vision. It wasn't until after high school that I realized that, hey, my family really does not have money. We do not have money. We will not be able for me to go to UWI. And so I thought, okay, I'm gonna get a job and I'm gonna work and I'm gonna save and I'm gonna go to UWI. And in that process, and there's always people who come along and they kind of help to change your life and shape your life. But I went to Grace and Staff, which is a community outreach. So Grace Kennedy, that makes Grace Foods, they have a community outreach. And so I did a holiday program at the University of the West Indies through Grace and Staff. And it was through them that I met Phyllis Thompson from Benedict. And she told me, hey, you could actually get a scholarship to go to college in the US. Like your grades are definitely going to get you a college scholarship. All you have to do is take the SAT, and you have to prove that you can also do well on the SAT. And it's so funny because she said, oh, at that time they would just say you have to get like a 99 to get a full scholarship. And I was like, oh, I can get a 99. And so it's that goes back to the mentality, the Jamaican mentality of saying, oh, if that's what you want me to do, of course I can do that. And so I did, and I got a full scholarship to Benedict College. And people say, why did you go to Benedict College? You could have gone anywhere in the US. And that was the only college I knew. That was the only people who reached out to me. And I am grateful for that, because that community, that, hey, we will hold your hand and help you and show you how to get to where you need to get to, that was at Benedict. So yeah, what was your question again now? I'm like
that perfectly answers it. It's okay. So when exactly did you come to the United States?
In Benedict? 2000.
2000,
mm-hmm.
Okay.
Mm-hmm. I've been here 20 years.
20 years,
yeah,
awesome.
Yeah.
Well, I think you kind of sort of allowed for that good segue. You're at Benedict now. You mentioned a little bit that you were drawn to research, particularly because you had good mentors. Mm-hmm. Tell me a little bit about your mentorship at Benedict, and what have you learned from that that's going to be really instrumental for your new lab that you're starting soon here at OSU?
Right. So at Benedict, my my primary mentor was Larry Lowe, and he was a mentor and an advisor. So he was somebody that was assigned to me to help me, and I was fortunate that he was excellent at both roles. I think that's not typically the case where your assigned advisor ends up being a great mentor as well, and so you have to find other mentors around. But in the sense that he was a great mentor, he was the one who took me in his lab and started me with pipetting and said, here's some summer programs. He had some funding from the NIH, and he said, hey, maybe here's a summer program at the NIH that you could apply for. And he was the one who kind of guided me to my first summer research project, and that was at the NASA Langley with Hampton University. And so I did a summer program, and it was looking at the effects of microgravity on skeletal muscle tissue, something that's way far out of anything I do now. But that fostered my love for research and being able to work with people in the community and that sense of discovery. And so I think that mentorship from him really, really guided me throughout the rest of my career.
We've talked about this long journey here. Now you're at the Ohio State College of Medicine. You're an assistant professor. You're about to start your own lab. And we know there are going to be lots of challenges in that process, but we know that you have the resilience to get through because you've gotten an MD PhD. Can you tell me a little bit about some of the challenges you experienced as a Black woman on this long journey? That's a lot of people don't really talk about that, but I think along the path we need to know kind of sort of the truth about what your experience is going to look like and kind of sort of what things you need to do to put in place to make sure that is a good transition.
Mm-hmm. So that I think it's an interesting question for me because I think probably one of the things as a Black MD PhD scientist is that I never really saw people like myself, and so I feel like I never really had people to ask certain questions that would have helped me along the way, questions that I didn't even know I needed to ask. But at the same time, I also feel that I didn't have that, but what I had was excellent. So I had excellent mentorship along the way. And I was telling somebody that most of my mentors to date have been white males. And it's because this is the space I'm in where it's mostly white males. And so those are gonna be your mentors. And I never felt less than. I feel like I was held to the standard of a white male. And I think that pushed me. I think if you think in your head, I'm a struggling Black female, I think that will kind of help you, or maybe that's a negative thing. So I never thought, I'm gonna get by with anything. It was always like, I have to be the best of the best at everything I do. And all my mentors always emphasized and stressed that for me, that, hey, this is what you have to do. On your step exams in medical school, you have to get, this is the bar that you have to be at. And so I felt like, in a way, it was difficult not seeing people like myself, but at the same time, I benefited from the people who I did see and who did reach out to help me. And in talking about Black female mentors, so Dr. Odette Harris at Stanford, she is one of the first professor of neurosurgery in the United States. And she was one of my mentors during medical school, and she was the first Black woman I saw who was doing research, who was doing surgery, and just doing all the things that I wanted to do. And so I really looked up to her, and she helped me in medical school, and she helped me find research that was meaningful in medical school. She mentored me. I thought I was gonna do neurosurgery in medical school, and so I really, I talked with her a lot about it. And then when I found out that neurosurgery wasn't the way for me, and I was more plastic surgery, she was equally as supportive. And she said, do what makes you happy. And so, yeah, she was a phenomenal mentor. And so that points me to, when you find somebody who is able to relate to you, it really does make a lot of difference. Mm-hmm.
So just on that one point, right? You can safely say that there is value in seeing people like you.
Absolutely.
Same lived experience.
Absolutely.
Wanting to aspire to that thing.
Right, and knowing that you can accomplish it, you can achieve it. And, this is somebody who worked her way to where she is, and just by hard work. And so, yeah, it absolutely is meaningful.
I'm going to say already, you inspire me because, of course, you're aware of where I'm trying to get, and we have a lot of similar background in history. And knowing that you were coming here totally changed the energy in the game, right? For me. So again, I can attest to the value of having a Black mentor who you can see yourself being in the future. You're here now. You've done all this research. What is your new research going to look like?
So I'm super excited about this new research. And to tell you about my current research, I think you have to understand a little bit about where I came from. So we already talked about my PhD in neuroscience, then my background in plastic surgery. So I thought I was going to do craniofacial surgery. And so during residency, I worked with Dr. William McGee, who was a craniofacial surgeon, Mark Urata, craniofacial surgery. And so I realized that I didn't particularly want to focus with pediatric populations, and I really like working with adults. And a part of the reason for that, for me, is being able to talk to patients and say, what do you want? How can I improve your quality of life, right? And so for me, having that relationship with my patients was meaningful. If you work with children, I have 2 children, I can tell you, there's no back and forth dialogue in that space. And so when I found out about neuroplastic surgery, which is the fellowship at Hopkins that focuses on adult cranial reconstruction, I realized this is exactly what I want to do. This matches up so much with what my goals are for my research and for my clinical work. And so neuroplastic surgery is a way to work with adult neurosurgical patients to help improve their outcomes. And that includes their aesthetic appearance, their functional capabilities. So when they're done with their surgery and the neurosurgeons have done a phenomenal job and their cancer is gone, can they go back to work? Can they assimilate back in their normal social environments, right? And so as a neuroplastic surgeon, that's my goal, to be able to help patients to get back to that norm. So in terms of my research, it's 2-armed. One, and the reason why it's 2-armed is because there's not a lot of neuroplastic surgeons doing research, and so there's a lot of work that needs to be done. One is on the clinical side, and that we've just started doing that, but we're looking at patient-reported outcomes, and what that means is asking the patient what's important to them. So we don't know, we don't ask our patients, what is when you have your neurosurgery and you're done, and you go back to work or you go back to your family, what are the concepts that are important to you? Does a scar on your face matter to you? Do you care about the scar? Do you care about if you have hair loss or alopecia in an area? Do you care about if you have a device that's visible on your bone, right? Intrinsically, we think to ourselves, of course patients care about that, but we haven't really engaged our patients in that way. And so now, when we make devices, medical devices, we have to prove to the FDA that, hey, patients really care about this. You should actually, insurance companies really should cover the cost of scar revisions because the scars really, really affect patients' outcomes. So it's things like that. So part of my research is a clinical aspect in developing measures to be able to ask patients those questions. And then the second part of my research is looking at different models, so translational research. So if we find something that needs to be done in the operating room, then we take that to the lab, we clarify that, fix it, get it to be in a state where we can then bring it back to the patient, so translational research. So those are my goals, mostly focused around improving patient outcomes after they undergo neurosurgical procedures.
And on that same subject, what really excites you about that field of research?
What really excites me is just being able to help patients and see really be happy with their outcomes. I think about it in terms of like breast cancer. So 20, 30 years ago, when patients came in with breast cancer, they had their cancer resected and they walked around with no breast, right? Nobody really reconstructed it. Plastic surgeons who did reconstruction, patients would have to pay out of pocket because it wasn't seen as something that was important. It's like, oh, that's just some cosmetic thing. No, it's not. It's actually something that's intrinsically tied into patients' well-being, that they're restored to their whole, they're restored to their normal. They can go to their family functions, work, and feel normal. And so we don't have that right now for patients who have brain cancer, right? Because 20, 30 years ago, we didn't have good outcomes for these patients. Now, the field of neurosurgery and neuroscience has exploded, where we have all these innovations and patients are living longer. They're using stereotoxic, radiotoxic chemotherapies, different approaches to actually cure patients of these cancers. And so now patients are living longer and they're like, now I'm surviving my cancer and now I can actually go back to my normal life. And so patients actually care about what they look like and what their functional status is. So that for me is really exciting to be able to help patients on that recovery process.
Dr. Mitchell, you talked to us a little bit about your research and how you hope to integrate that with your clinical practice. And that highlighted a really important subject for all us MD PhDs and future mudphuds, is that you're going to be a surgeon-scientist is the title. Not a lot of students are encouraged to do a surgical scientist pathway. Tell me what challenges you will encounter in that path, and how you will hopefully circumvent those.
That's a great question, because there really aren't that many surgeon scientists, and I'm not sure, I don't know exactly what is the deterrent. It is a challenging pathway, but it is also a very rewarding pathway. And so for students who are looking and trying to figure out, well, what do I want to do? I think it all comes down to what you like to do and what fulfills you. If you are, and many students starting out don't know if they want to become a surgeon or if they want to be a clinician, or the field of medicine is vast and you could choose any number of pathways. Clinicians probably are able to integrate their research directly back into their clinical practice more readily, especially if you're doing clinical research. You're probably recruiting patients from the same patients that you see in clinic. You're running clinical trials with that same population. Whereas from a surgical perspective, you're typically you're operating on one patient at a time, and it may be harder to go from bench to bedside. And it may be also more challenging just from a time perspective of being able to allocate your times to one versus the other. And I think that's part of a challenge that I may end up facing with being able to balance that. And one of my mentors, my current chair, Dr. Amy Moore, that she tells me is that people tend to, if you gravitate to one over the other, then one will fall by the wayside. You always have to constantly maintain that balance. If it's what you want to do, you have to do enough clinical research or enough research and also be able to see your patients if you're going to be a true surgeon scientist. And so that's something that I think having support, so you need to have a supportive department, supportive chair. My chair is extremely supportive. That's part of the reason why I'm here at Ohio State, is that I knew I would have her support to be able to build this career. And you also need to make sure that you're always constantly thinking about what your big picture is, what your goals are. And so for me, I love operating. I could easily be a surgeon and not a scientist. I could go to the OR every day and happily operate and see my patients. I could just as easily just do research. I love when I'm thinking through grants and I'm thinking through projects and I'm thinking what's the next step. So I think I could be happy in either silo, and so it's just important to be able to balance that. And then, for future students or MD PhDs, I think it's not as critical to define what you want to be. I think what's more critical is what you like to do. So if you like being in clinic and seeing tons of patients, you should be a clinician. That's your motivation, and that feeds you, and that's what keeps you going. I would not be able to do that. I am at heart a surgeon. I love being in the operating room. It's my Zen space. And so if that's your thing, then you absolutely will be able to balance it. If you like what you do, you'll be able to do it.
Okay. And so speaking of balance, the traditional balance is 75% research, 25% practice. Are you going to follow that same traditional path?
Actually, no, I'm fortunate. I am 50% research and 50% clinical practice. And I say fortunate because that allows me enough time to be able to do both. And if you're getting funding from the NIH, like 75% is typical at a bare minimum. That time that or 25% research, 75 clinical. That's like the minimum that you're going to be able to be successful. And so for me, doing 50-50, it really allows me that time to be able to focus on both. Well.
Okay. Mm-hmm. Again, thank you so much for being here and sharing a little bit of your journey. Right, some of the things that sustained you along the way. To summarize your research, medical journey, can you tell me what really motivated you and kept you on this path? And if you can think about a quote or something that really grounded you every single day, share that with us and our audience.
Sure. So I think what motivates me is really my patients. I think every time I do something, I think what's the long-term result and what does this mean for my patients? And I think even when I was doing research in graduate school, I was doing epilepsy research, and it was the thought of how can I help patients with epilepsy. I wasn't even a clinician then, but it was still the patient that guided me and kept me motivated. And if you're in the lab working late on something and you set your standards or your bar so high, it's because you know that ultimately this will help somebody. And I think that's what has kept me motivated and keeps me motivated. And then one of the quotes that I would say that has kept me grounded, and you probably will know this, Shane, but one of my absolute favorite quotes that I learned in primary school, which is equivalent to kindergarten, is the heights by great men reached and kept were not attained by sudden flight, but they, while their companions slept, were upwards toiling through the night. Right? See, you know it. But we learn that, and I still I'll be up studying or doing something, and I'll say that in my head, and it'll just okay, reset. I just need to keep going. So yes, it's funny, right?
No, that's impressive. I think that's what I tell myself as well. So I'm just this is interesting. Yeah, I think, for me, it goes again back to those formative years where those things were rooted in you and how to get through. Right. When other people are sleeping, it's okay to keep working because what what's God has in store for you, or what's for you, is going to be for you, and your path is going to be very, very different. So it doesn't mean, if that means that you have to, study a little bit later, it's perfectly okay. That's really interesting. So to kind of sort of transition to kind of sort of an aspect of the MD PhD path that we don't really, as students, we don't get a good glimpse of. So we kind of sort of ask you guys who've done it, is kind of sort of your personal life throughout this pathway. Mm-hmm. So it's a long journey. Like you mentioned, you have to stay up studying. Most of the time, at least for me, studying comes first, people come second. Right. My family's on the first as well because they're a part of that process. But, how do you, on this journey, how do you find and sustain life with a significant other? Can you tell me a little bit about that in your journey?
Absolutely. So it's an interesting question because I think my husband is my strongest supporter in so we've been together for almost 15 years. And so I met him in graduate school. So before medical school, before residency, before any of this. And he always has my back and he always supports me, and he will always be the person who makes me a cup of coffee if I'm up studying late, So I think it's important to recognize the people who are meaningful in your life and helps give meaning to your life and nurture that. So in terms of my life, when we were in medical school, I knew there was no way I could have a child at that time, I did know I wanted children, but I thought there's no way I could have a child and be able to go through medical school. And I remember even in medical school, we spoke with some of our female faculty. In one of those faculty I mentioned earlier, Dr. Odette Harris, she has 2 children. And I remember asking her, like, how are you able to balance that? And she said, and I never forget that because I still live by that to this day, she said, choose the things that are important to you, and whatever is not, let it go. So you have to prioritize, and prioritizing for me means what's important in this minute. And so if I'm in the operating room, that patient on the table is the only thing that's important to me, right? The world could be crashing outside. It's that person who's on the table that's important. If I'm home with my family, that's who's important to me, right? My kids are important to me. And sometimes that's hard to be able to separate like that because I'm on call, right? And so my kids understand that if I'm on call or if I operated and I have a patient and a patient needs me, I'll need to go. My 4-year-old son can tell you, like, oh, my mom's on call this weekend. We're gonna be at the park, but she may need to leave, right? But I feel like being very transparent with people in your life helps them to understand that, hey, right now I'm here and I'm all yours. In the next hour, I'm gonna be somewhere else and I'm completely unavailable, right? And it's prioritizing in the moment and knowing that they're all important, and it's just what time and when they're important.
That's good. I'm going to take that gem and tuck it away for the future, because I really do a bad job at that, and it's been like everybody's complaint against me is that
You're unavailable.
Yes.
I get that too. Yes.
Always unavailable. So like, speaking of that, and you're going to do a 50-50 research, like how do you foresee, struggles of juggling a family with your demanding life as an MD PhD?
I think it's just the same as if I were a surgeon and not a surgeon scientist. I think it would be the same. We say you work full time and then your second job, right? And so it's never a 40-hour work week, right? You're at work physically in this space for however many hours, but when you go home, you still have to catch up on things. You still have to do your patient charting. You still have to do your notes. And so being a surgeon scientist, it's the same thing. You're here and you do your job, and then you go home and you still have to write the papers, and you still have to write the grants, and you still have to do that. And so for me, I try to compartmentalize as much as I can, meaning if I am home and I'm eating dinner with my kids, I'm home and I'm eating dinner with my kids. And then when my son goes to bed, I stay up late, and then that's when I work on a grant. And so people will see an email from me at 2 a.m. and they're like, whoa, why are you up? And it's because I spent my evening with my child, right? When he's awake and when he gets home from school, I'm available. And that means that at nighttime, I still need to be up working. And I do think it's important to be able to compartmentalize, because if you're always constantly being pulled away, I think that's just my personal opinion, N of 1, that if you're being pulled away constantly, it's harder on kids. Mm-hmm.
So enough about like all that stuff. What are your hobbies? Tell me some fun stuff.
Fun. Cool. My hobbies change. If I were to pick one thing that I love doing the most, it's running outside. And now I'm in Columbus, Ohio in winter. I'm not running outside in Columbus, Ohio in winter. So I need to figure new hobbies for here. I like reading, so I'll read fiction. And when I was in Salt Lake City, I skied. I had a ski pass every year, and I skied every season. So I think my hobbies fluctuate based on where I am. I think now I rock climbed for a while, so I love rock climbing, but I haven't done that in a while either. So I think now my plan is that I'm going to train for a marathon, but I'm going to do it all indoors and run on a treadmill, which I've never really done before, like run on a treadmill. So
sounds good. Definitely gonna have to teach me how to ski, because I don't know how to do that. And it's, when I was in Jamaica, yearning to be here on Disney Channel, I'm like, oh my God, I gotta go learn how to ski. But that hasn't happened yet. I've seen the snow and enjoyed the snowmen and stuff, but haven't done that. So, now that we're wrapping up, really, to our students who are gonna be watching this, right? what is your advice to them? Whether, they are prospective, not yet gotten to the MD, PhD, so they're in their college, about to apply. For other kids who don't know that this is a vision yet, they're in high school, probably, they're gonna be watching with their parents. What do you have to tell them about this journey that, you're guaranteeing that they're gonna wanna come on this journey with you and join your ranks, or, come after you and show people that MD, PhD is a path for them? Like, what do you say to them?
So it's very rewarding pathway. It's challenging, no doubt about it. It's a very challenging pathway, but it's also very rewarding. And I think it's not for everyone. I think you have to know that what drives you and why do you want to do it. Being a scientist is extremely rewarding. Being a surgeon or a clinician is also very rewarding. And if you don't like research and you don't like to, many people don't, and they love taking care of patients and they like taking the data that's available to them and implementing that in patient care. So I think if you're somebody who likes innovating and who likes thinking and who likes discovery, then absolutely a scientific pathway is for you. Do you absolutely need a PhD to be able to do research? No, there are tons of clinicians who do research and they don't have a PhD. But I think what a PhD does is it builds you an even stronger foundation of research that you can apply to. You can ask the questions, you could design the studies, you could design the trials. I think that's what a PhD offers. And it's a longer way, but if you enjoy the journey along the way, like I absolutely loved graduate school and working on my model of epilepsy, right? So I think if you, along the way, you enjoy the process and not just think, geez, this is gonna take me however many years, then it makes it worthwhile. So one of the things that 2020 has brought to light is how critical it is for us to be able to see what we want to be. And another way to phrase that is you can't be what you can't see. And I think it's now brought to light that there are Black physician scientists and surgeon scientists that are here. And AABPS has created a place for us to all meet and form that community and be able to help and foster that community further. So we needed this and now it's here. So join AABPS.